Hello, this is Dr. David Green, CEO of the TEX-PAIN Network. Today's topic is what you need to know about epidural injections. An epidural injection is an outpatient procedure involving steroid and numbing medicine being placed into the epidural space, and it's designed to relieve the pain from pinched nerves. The epidural space is the area around the spinal cord where the nerve roots come off, okay, so it doesn't go into the spinal cord or the nerve roots. The indications for an epidural injection include a herniated disc with radiculopathy or sciatica. Sciatica is pain that goes down one of the lower extremities from one of the lower nerve roots being pinched. Radiculopathy also includes the neck. Spinal stenosis is a condition where arthritis overgrows bone and or soft tissue, and it can lead to nerve roots getting pinched. Degenerative disc disease can inflame nerve roots due to a tear in the outer part of the disc, and then compression fractures actually can irritate nerve roots as well. There are three different types of epidural injections. There's interlaminar, transforaminal, and caudal epidural injection. This is an example of an interlaminar. So here you have the back of the spine with the spinous process. These are the bumps you can feel. Okay, this bone is called the lamina. This bone is called the lamina. So interlaminar, there's some soft tissue where the needle goes through, and then you get into the epidural space. This is the initial type of epidural injection that was invented back in the 1950s. So for the last 60 years, this has been a mainstay epidural type of injection. When you look at a transforaminal, this is the newest type of epidural. So you see up here we have the lamina, and that's where the epidural would have gone. No, not for this one. Actually, the transforaminal goes right here where the nerve root actually comes out from the spine. This is called a foramen. This is the transforaminal space, and that's where the needle goes. Okay, it's designed to put the medication as close as absolutely possible to where the nerve's actually getting pinched, and these have typically an excellent outcome. A caudal epidural injection is great for when multiple nerve roots are being pinched, and here's why. The needle goes into the very lowest part of the spine. Here's the sacrum. Okay, this is called the sacral hiatus, this opening here. A larger amount of medicine is injected, and it migrates up into the lumbar area so it can reach multiple areas of nerve root pinching, such as with spinal stenosis. How are these performed? They're outpatient. They take about 30 minutes. You can do local numbing, plus or minus IV sedation. Most patients don't need IV sedation, but if they're claustrophobic or if they've done well with sedation before, most modern pain management doctors will use fluoroscopy, which is a real-time form of x-ray. You can see it in the picture here. It looks like a C, so it's called a C-arm, and it's on the screen. The x-ray shows up, and the doctor knows exactly where the needle's going. When they're excited about where the needle is, they'll inject some dye to make sure they're satisfied with placement, and after that, they'll inject the numbing medicine and the steroid. Patients go home the same day within about an hour. Epidural injections work very well. There have been dozens of studies over the last few decades looking at how well they do. Overall, there's a 75 to 90% good to excellent result with them. A person may need a series of 3 injections over a 6-week period for maximum benefit. The numbing medicine that's injected usually works right away, and the steroid will kick in after about 2 to 3 days, and it may last a few days or it may last a few months. The risks of epidurals: there's a slight risk of infection, bleeding as well. A person should stop anti-inflammatories 5 to 7 days prior. There's a risk of an allergic reaction, side effect of the steroid, which is usually transient, potential for nerve injury. The worst risk is that it may not work. Overall, the complication rate is under 1%. Are epidural injections FDA approved? They are not for use in the spinal canal. This is not necessarily a bad thing, okay? Medications are used all the time for off-label indications effectively 40% of the time in the U.S. It's legal. It's often beneficial. Here's 3 examples. Neurontin is FDA approved as an anti-seizure medication. It's often used off-label for nerve pain and migraines. Lidoderm is an FDA skin patch approved only for shingles, and it's off-label used for back pain and other numbing needs. Propranolol is FDA approved for high blood pressure, but we know it's often used for off-label for performance anxiety. So that's not necessarily a bad thing at all. The top non-operative pain management in Texas is through the TEX-PAIN Network. There are several clinics throughout the Dallas-Fort Worth Metroplex accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.